Hello, Ashley. This is Meryl, and this is my critique on your chest and extremities health assessment. I'm sorry, but I noticed a bunch of stuff in your video. First of all, the camera is not correctly placed, it was tilted sideways. Then the room is kind of dark, so it's hard for me to see what you're actually doing to the patient. Um, then when you're assessing the skin, you actually have to show that you're actually inspecting it, not just by looking, but you have to look front, back, and side to side. Um, when you assess the JVD, make sure that the patient um, lay down first, and then raise the patient, and then verbalize the JVD findings, and then raise the patient to a 45-degree angle, um, and then also verbalize the finding. For when you auscultate for Brewy, you did not say which side of the stethoscope you have to use, and you also have to tell the patient to take a deep breath and full respiration, and then hold their breath for a few seconds so that you can um, listen for the Brewy. And then there was a one thing in there that you said that you're gonna palpate, but you actually percuss. Um, Also, you must verbalize where you're percussing, like the landmarks. Um, you also have to verbalize that in real situation, like in a hospital or in real patient, we have to auscultate or listen through bare skin, not on like not with not on the gown or like a shirt. um, you have to when you say the when you listen to the heart sound, you did not verbalize the rate and rhythm of the heart sound. You didn't say if you heard where did you hear the S1 and S2, or if you heard it, you didn't say anything about that or any extra heart sound. Also, you have to verbalize that when you listen to a murmur, uh, you have to use the bell side of the stethoscope, because the bell side has low pitch sounds, and that's what we use when we have to listen to like abnormal sounds or murmur. You also did not mention um, the 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 lateral landmarks, okay, on the posterior side, like on the side, like over here, when you like which part do you um, listen, percuss, and palpate. You didn't mention this part. um, and also I noticed that you assess the tactile fremitus and mention that there's no crepitus noted, but there actually but when the tactile fremitus and the crepitus is actually different. Okay, I think you said the same results on that one. Um, um, you also have to uh, verbalize that you will instruct the patient to take a deep breath if you're gonna listen to their lung sound. If you're gonna listen, you have to wait you have to listen for the whole full respiration. um, Also, the things that I like is you mentioned every finding's really good. Your subjective questions are really good. Your carotid assessment when you verbalize the findings, there I like that. Pain assessment, you mentioned the PQRST. That's important as well. So you did mention that, so I like that one. Um, yeah, subjective questions are good because you ask the patient's history, family history, and stuff like that. Um, what else? Yeah, the when you mentioned the findings, the results, and some of the things that you did, the assessment, I like that as well. And also, uh, the biggest thing is the video is not finished. It just ended. Um, yeah. So I hope that this critique can help you for your final head to toe. So thank you. Good.